Hello and welcome back to my channel. In this podcast, Andrew Huberman talks about ADHD, Attention Deficit Hyperactivity Disorder, covering its biology and psychology, common myths, behavioral and pharmacologic treatments, brain-machine interface tools, and behavioral training protocols to improve focus. The episode also reviews prescription and over-the-counter compounds for increasing focus, the role of diet, and the controversies surrounding it. Huberman discusses ADHD and its relation to focus and attention. He explains that ADHD has a strong genetic component with a higher likelihood of having ADHD if a close relative also has it. ADHD is not related to intelligence, and individuals with ADHD can have varying IQ levels. The renaming of ADD to ADHD in the 1980s led to improved diagnosis and detection of the disorder. Currently, it's estimated that about 10 to 12% of children have ADHD, with about half resolving with treatment. There is also an increase in ADHD diagnosis among adults, potentially influenced by factors such as smartphone use and information overload. Andrew talks about attention, focus, and concentration and how they are essentially the same thing in the context of ADHD. Attention is defined as perception, the process by which we perceive the sensory world. People with ADHD have trouble holding their attention and are easily distracted. They also have high levels of impulsivity and lack impulse control, which means they have trouble limiting their perception. However, people with ADHD have the capacity to attend, but they can only engage their attention for things they enjoy. People with ADHD also have challenges with time perception, often running late and procrastinating, but they can focus very well if the consequences of not completing a task are severe enough. Additionally, their spatial organization skills are often subpar, and they tend to use the pile system to organize things. While many people use the pile system, people with ADHD do so without any logical framework. These challenges can make it difficult for people with ADHD to complete tasks and meet deadlines. Huberman explains the concept of working memory and its relationship to ADHD. He explains that people with ADHD often have a long-term memory but struggle with working memory. Working memory refers to the ability to keep and manipulate information in the mind for a short period of time. Individuals with ADHD find it difficult to remember and hold on to information for a short duration, even simple sequences of numbers. Deficits in working memory are also observed in conditions like frontotemporal dementia and age-related cognitive decline. Huberman highlights that treatments, supplements, and tools used for ADHD are often similar to those used for age-related cognitive decline. He emphasizes that individuals with ADHD can achieve heightened levels of focus and hyperfocus on things that interested them. Huberman discusses two types of neural circuits that are related to ADHD: the default mode network and the task networks. The default mode network is active when the brain is at rest and not engaged in any specific task, while the task networks are involved in goal-oriented behavior. In a typical person, the default mode network and the task networks are anti-correlated, meaning they are opposing one another. However, in people with ADHD, these two networks are more coordinated, which is abnormal. Dopamine acts as a conductor in this context, regulating which circuit should be active. When people with ADHD are treated or age out of ADHD, the default mode networks and task networks tend to become anti-correlated again. He talks about the low dopamine hypothesis of ADHD, which suggests that when dopamine levels are too low in certain circuits in the brain, it leads to unnecessary firing of neurons that are unrelated to the task at hand. This can lead to difficulties in focusing and paying attention. People with ADHD tend to seek out stimulants such as caffeine, cigarettes, cocaine, and amphetamines, which increase dopamine levels in the brain and help regulate attention. Children with ADHD often show a preference for sugary foods, which also act as a dopamine-inducing stimulants. However, these substances have a high potential for abuse in adults, and their use as a treatment for ADHD should be carefully monitored. Huberman discusses the relationship between various compounds such as sugar, Ritalin, Adderall, Modafinil, Armodafanil, and ADHD. He explains that it was once thought that individuals with ADHD consumed sugary foods or recreational drugs because of their inability to make good decisions or their impulsive behavior. However, it's now believed that individuals with ADHD are self-medicating with these compounds to increase their levels of dopamine, which is necessary to coordinate neural circuits that allow for focus and quality decision making. While children who consume anything that increases their dopamine levels tend to be calmer and more focused, those who don't have ADHD tend to become super hyperactive. Huberman cites an anecdote to illustrate this, where he gave children dark chocolate with espresso beans, which led to increase in dopamine and hyperactivity. Huberman explains that low levels of dopamine are what is wrong in individuals with ADHD, and treating them with dopaminergic compounds such as Ritalin, Adderall, and Modafinil increases their ability to focus. Ritalin was the first drug prescribed for ADHD, while Adderall is now the more commonly prescribed drug. The difference between these drugs are due to their pharmacokinetics, which affect the rate at which they enter the system and how long they last in the system. Andrew Huberman discusses the high prevalence of stimulant use, specifically Adderall, among young people without clinical diagnosis of ADHD. He notes that the use of Adderall without prescription has surpassed cannabis use in that age group. He acknowledges that the discussion about why people are increasingly using stimulants and whether it is due to the demands of modern life is interesting, but unlikely to provide definitive answers. Huberman highlights that people have been using substances like caffeine and nicotine to increase focus and alertness for a long time. He mentions that children diagnosed with ADHD can benefit from stimulant medications like Adderall because they help activate the task-related networks in their brain, allowing them to learn and experience focus. However, he also points out that using drugs artificially to induce focus is different from genuinely being interested in something and learning to focus on it. Huberman shares a conversation with a colleague who specializes in treating ADHD in children. The colleague suggests that low doses of amphetamines, such as Adderall, can be beneficial for young children with ADHD as long as the dosage is adjusted as they grow older. Huberman emphasizes the importance of consulting a doctor when considering medication for a child. He raises a question of whether waiting until puberty, when hormonal changes impact brain function, would be a better time to consider medication. However, his colleagues explains that neuroplasticity is highest during childhood, particularly between the ages of 3 and 12 or 13, and early treatment can help reshape the brain's frontal circuits and improve focus. Huberman emphasizes the importance of early intervention and working with a qualified physician, but notes that medication should not be the only approach and that other factors like diet should also be considered. Huberman discusses the impact of diet on ADHD symptoms in children and adults. He begins by explaining that certain diets, such as elimination diets that eliminate sugar, dairy, or gluten, have been claimed to improve symptoms of ADHD. However, given that individuals with ADHD are naturally drawn to sugary foods, studying the role of diet and nutrition in treating ADHD is challenging. Andrew Huberman mentions a study involving 100 children that demonstrated significant improvement in ADHD symptoms through elimination diet. The diet involved removing foods that the children had mild allergies to, and the results showed enhanced focus, reduced impulsivity, and less restlessness. Although the study received praise, it also faced criticism regarding its overall structure. Huberman shares an anecdote from pediatric neurologist who treats ADHD, noting that eliminating simple sugars from the diet had a profound positive effect on ADHD symptoms in many of her patients. The discussion then shifts to the role of omega-3 fatty acids in ADHD management. Huberman explains the known benefits of omega-3 fatty acids in areas such as mood elevation and cardiovascular health. He suggests that consuming 1 gram or more of the EPA component of omega-3 fatty acids, typically through fish oil supplements, may help adults with ADHD function well on lower medication doses or potentially eliminate medication in some cases. However, he notes that the effects of omega-3 fatty acids on focus and attention are modest and vary across studies. Huberman talks about the importance of understanding the distinction between modulation and mediation in relation to various factors influencing focus and attention, particularly in the context of ADHD. Just as sleep modulates cognitive processes, dietary factors like omega-3 fatty acids can also modulate attention and mood by affecting dopamine availability and receptor binding. While certain diets or supplements may have a modulating effect on ADHD, they are not the sole solution or a guaranteed switch for improvement. Medications like Ritalin and Adderall mediate attention and focus through specific neural circuits. Huberman emphasizes the need to consider modulation versus mediation when attempting to optimize brain function and explores alternative treatments and behavioral strategies for enhancing focus. Andrew explains the concept of attentional blinks, which are moments when attention falters and individuals fail to notice certain stimuli while focusing on others. He gives the example of searching for Waldo in a picture and describes how the nervous system releases neurochemicals when the target is found, leading to a momentary pause. During this pause, individuals are unable to see another target that may be present nearby. This phenomenon is also observed in laboratory experiments where participants are asked to identify specific letters or numbers in a string of characters. People with ADHD tend to experience more attentional blinks than those without ADHD, indicating that they may overfocus on certain elements and miss other relevant information. This challenges the common perceptions that individuals with ADHD simply cannot focus. Understanding attentional blinks suggests that increasing focus and reducing distractibility involves not only improving the ability to focus, but also avoiding overfocusing on specific elements and broadening attention to capture a wider range of stimuli. Huberman explains the concept of open monitoring, a state of attentive awareness that allows individuals to recognize multiple targets and enhance their focus. He explains that the visual system has two modes, highly focused and panoramic vision. Panoramic vision, achieved by consciously dilating one's gaze, activates a separate set of neural circuits that process information at a higher frame rate and enable better temporal processing. This ability to access panoramic vision and open monitoring can be trained and practiced by anyone, regardless of whether they have ADHD or not. Huberman highlights a simple practice of 15 to 20 minutes of sitting quietly, focusing on breathing and internal sensations, which has shown significant improvements in attention and reduced attentional blinks. This practice can potentially offset age-related cognitive decline as well. Engaging in panoramic vision and incorporating open monitoring into daily life can rewire attentional circuitry and enhance information processing. The effects of these practices are long-lasting and can be achieved even after just one session. Huberman encourages individuals to consider incorporating these practices into their routines for improved focus and cognitive function. Huberman explores the relationship between blinking, dopamine levels, and time perception. Blinks can be fast and spontaneous or long when going to sleep, and they serve as resets for our perception of time. Dopamine controls the rate of blinking, which in turn affects attention and focus. When dopamine level increase, people tend to overestimate time intervals, perceiving things in slow motions. Conversely, lower dopamine levels lead to underestimation of time intervals. Individuals with ADHD, known for their poor time management and focus, have low dopamine levels and underestimate time. However, studies have shown that training in blinking and visual focus can enhance their attention and focus. By consciously controlling blinks and engaging in fixation-focused activities, such as looking at the visual target, individuals can improve their ability to focus on other information. Physical movements before the training can help reduce the urge to move and enhance the effectiveness of the focus training. Andrew Huberman explains that the use of fidget toys or repetitive physical activities is an effective treatment for children with ADHD to help them focus and control their energy. These activities, such as pulling on a rubber band or tapping a foot, redirect the excess reverberatory activity in the nervous system and allow the child to engage their physical energy while maintaining mental focus. This technique can also work for adults, as seen in the example of surgeons who tap their foot to reduce handshaking and perform surgeries more precisely. Huberman also discusses the relationship between blinking, focus, and the effects of drugs on attention. Drugs like Ritalin, Adderall, caffeine, and cannabis that increase dopamine levels tend to reduce blinking and enhance attention. However, cannabis, despite increasing dopamine, also affects other neurochemical systems like serotonin and cannabinoids, creating a state of calm along with alertness. Studies have shown that chronic cannabis use can lead to a decreased spontaneous eye blink rate, indicating increased focus but potentially affecting memory. Huberman discusses the concept of interoceptive awareness in individuals with ADHD. Interoceptive awareness refers to one's perception of internal bodily states like heart rate and breathing. There was a hypothesis that individuals with ADHD lacked this awareness and that improving it would enhance their functioning. However, a study on interoceptive awareness in ADHD found no significant difference compared to individuals without ADHD. People with ADHD are aware of their internal states but struggle to enter a cognitive state that allows them to focus and access necessary information. It is incorrect to assume that individuals with ADHD are oblivious to their feelings. The challenges they face are related to coordinating task-directed networks and neurochemical regulation, particularly involving dopamine, norepinephrine, serotonin, and acetylcholine, which is crucial for cognitive focus. Huberman discusses the use of prescription drugs and emerging non-prescription approaches to increase dopamine, acetylcholine, and serotonin levels in the brain for ADHD treatment. Common drugs like Ritalin, Modafinil, and Adderall are mentioned, which work by increasing dopamine and norepinephrine. Different dosages and combinations are used based on severity and individual factors. Huberman refers to a review that compares these drugs to substances like MDMA, cocaine, and amphetamines, blurring the line between treatment and abuse. Side effects include anxiety, insomnia, and sexual difficulties, especially with stimulants. Most of these drugs have cardiac effects, increasing heart rate and constricting blood vessels. Caffeine is discussed separately, with its effects varying depending on adaptation. Huberman emphasizes the importance of understanding the potential side effects and considering a combination of drug treatment with behavioral exercises to enhance focus and train targeted brain circuits. The goal is to eventually taper off drugs and rely on natural cognitive abilities. Huberman explains that consuming omega-3 fatty acids, particularly DHA, at least 300 mg per day, can positively affect attention and focus. EPA is also important, but DHA seems to have a greater impact. Phosphatidylserine, taken at a dose of 200 mg per day for 2 months, has shown potential in reducing ADHD symptoms in children, especially when combined with omega-3 fatty acids. Ginko biloba is another compound that some claim to be beneficial for ADHD symptoms, but its effects are minor compared to medications like Ritalin and Adderall. However, Ginko biloba can cause headaches due to its vasoconstrictive and vasodilating properties, so individuals should consider the side effect when considering its use. Overall, ensuring sufficient levels of DHA, EPA, and phosphatidylserine can serve as an important augmentation for improving ADHD symptoms. Huberman discusses the drugs Modafinil and Armodafanil, which are growing in popularity for their focus-enhancing effects. They are used to treat ADHD, narcolepsy, and by individuals who need to stay awake for long periods. Unlike Ritalin and Adderall, which are stroke dopamine reuptake inhibitors, Modafinil and Armodafanil are weaker stimulators, leading to increased dopamine levels. They also act on the Orexin system, which regulates hunger, sleepiness, and narcolepsy. Modafinil is effective treatment for narcolepsy and enhances attention and focus, although not as intensely as Adderall. Armodafanil, a cheaper alternative to Modafinil, works well for some individuals. Huberman shares his personal experience with Armodafanil, taking a half dose to combat jet lag and experiencing prolonged cognitive effects. He notes that he is sensitive to medication and often requires lower doses. In his current state, he relies on coffee, yerba latte tea, and water, not taking any of the discussed compounds. Huberman explains the role of acetylcholine as a neurotransmitter involved in muscular contraction and its release in 2 brain regions, the PPN and the nucleus basalis. These sources of acetylcholine collaborate to activate specific brain areas, bringing about focus and attention to particular synapses. Drugs that increase acetylcholine transmissions, such as Alpha-GPC, a form of choline, can enhance focus and cognition. Higher dosages of Alpha-GPC, around 1200 mg, have been shown to counteract age-related cognitive decline. For studying or enhancing learning, typical dosages range from 300 to 600 mg. However, it is essential to consult with a doctor and consider individual safety margins. Alpha-GPC stimulates acetylcholine release from both the PPN and the nucleus basalis, contributing to improved focus through the cholinergic system. Huberman highlights 3 over-the-counter compounds used for ADHD treatment and improving focus. The first is L-Tyrosine, an amino acid that increases dopamine levels which can enhance focus. However, finding the right dosage is challenging as it can lead to side effects like euphoria or jitterness. Caution is advised, especially for individuals with underlying psychiatric or mood disorders. The second compound is PEA, phenethylamine, and its related compounds which stimulate dopamine and are explored for their potential in boosting dopamine levels. Again, dosage must be carefully considered. Andrew suggests referring to examine.com for more information on these compounds. Lastly, Huberman mentions racetams such as Nupap, which tap into the cholinergic system and show promise in improving cognitive capacity and focus, particularly in cases of mild cognitive disorders and brain diseases caused by trauma or vascular events. Andrew discusses transcranial magnetic stimulation, TMS, as a technology for treating ADHD and enhancing focus. TMS involves placing a coil over specific brain regions and using magnetic stimulation to modulate their activity. It can increase or decrease activity in targeted areas, impacting neural circuits, behaviors, thoughts, and emotions. In the context of ADHD, TMS is being used to stimulate the prefrontal cortex, the region associated with task-directed focus. Unlike drug treatments, TMS offers a non-invasive approach to teaching the brain to learn. Clinical trials are comparing TMS with pharmacological treatments for ADHD, and Huberman emphasizes the exciting potential of combining drug treatments, technological interventions like TMS, and behavioral strategies to optimize focus enhancement for both children and adults with ADHD. Lastly, Huberman highlights the negative impact of smartphones on our ability to focus regardless of whether we have ADHD or not. The constant switching of context within the phone leads to a rapid turnover of attention, making it difficult for the brain to cope with the overwhelming amount of information available. Studies suggest that excessive smartphone use can induce attention deficits similar to ADHD. For adolescents, using the phone for less than 60 minutes per day helps maintain focus, while adults should aim for a maximum of 2 hours per day. Limiting smartphone use is crucial for maintaining and improving focus, which is essential for success in various aspects of life. This is it for this podcast. If you like my summary and content, please like, subscribe, and comment below. Stay tuned for more videos. Thank you, and I'll see you soon.